Commencing 2020, the Year of Nurses to Achieve SDGs, ICoNURS give an opportunity for nurses to discuss their strengths in order to optimize their contributions to implementing the SDGs. Ladies and gentlemen, I would like to extend a very warm welcome to all of you. We would like to appreciate and thank to all of you for being able to be here in the middle of your busy schedule. We hope that this conference will be fruitful and engaging. To begin the event, I would like to invite Miss Shirley Agustina to recite the Holy Quran. To Miss Shirley Agustina, the time is yours.
Assalamualaikum warahmatullahi wabarakatuh. A'udzu billahi minasy syaithanir rajim. Bismillahirrahmanirrahim. Ya ayyuhalladzina amanu idza qila lakum tafassahu fil majalis تفسحوا في المجالس فافسحوا يفسح الله لكم وإذا قيل انصزوا فانصزوا يرفع الله الذين آمنوا منكم والذين أوتوا العلم درجات والله بما تعملون خبير صدق الله العظيم. I took refuge in Allah from the temptation of accursed Satan by saying the name of Allah who is loving again most merciful. Oh, you have believed when you are in assemblies. Then make space, Allah will make space for you. And when you are short, arise. Then arise. Allah will arise. Those who have believed among you, and those who were given knowledge by degrees, and Allah is acquainted with what you do. Righteous God with all His word. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Ms. Shirley Agustina. Let's move on to the next agenda, which is singing national anthem of Indonesia, Mars Muhammadiyah, and Mars of Indonesian National Nurse Association.
Persatuan Perawat Nasional Indonesia, wujud ikatan profesi perawatan, tempat membina dan mengembangkan kemampuan diri dalam membuktikan keberadaannya. Menapaklah dengan keyakinan lebih pasti, sejajar dalam hakikat diri, bangkit berdiri dan langkahkan kakimu itu, menatap hari esok penuh asa. Wahai perawat Indonesia, bangkitlah dan majulah untuk menolong sekarang menderita. Kuatkanlah pribadimu, tingkatkan pengetahuan untuk memberikan asuhan keperawatan. Kita melangkah untuk mengisi pembangunan bangsa negara Indonesia, untuk menghantarkan bangsa menuju sehat semua dengan semangat jiwa Pancasila. Maju perawat, majulah dalam kancah pembangunan, tunjukkanlah pada sekalian orang. Jadilah perawat model kesehatan bangsa kita, jadilah teladan dalam hidup sehat. Bangkitlah perawat seluruh Indonesia dalam mengemban citra profesi, menjunjung tinggi kode etik keperawatan, laksanakan panggilan tugas mulia. kesehatan seoptimal mungkin bagi warga negara Indonesia. Sebagai bukti kiprahnya mahkota putih suci dalam mendukung pembangunan kesehatan. Dengan organisasi PPNI yang kokoh, padu bersatu, serta selaras, perawat Indonesia akan mampu angkat citranya di mata insan dunia.
Ladies and gentlemen, it's my pleasure to invite the chairman of the Second International Conference on Nursing 2020, Dr. Titi Huriyah, to deliver her opening remarks. To Dr. Titi Huriyah, the time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin wa bihi nasta'in ala umuri dunya waddin. Wassalatu wassalamu ala asrofil anbiya'i wal mursalin wa ala alihi wa ashabihi ajmain. The Honorable Director of Universitas Muhammadiyah Yogyakarta, Dr. Insinyur Gunawan Budianto MP, the Honorable all the Vice Rector of Universitas Muhammadiyah Yogyakarta, the Honorable Head of ICoNURS 2020, Dr. Yeni Rosilawati, the Honorable the all Chief of Focal ICoNURS 2020, the Honorable Keynote Speakers of ICoNURS. The first one is Professor Aisha Holloway from Edinburgh University, United Kingdom. The second one is Professor Lim Swihya from National University, Singapore. And the third one is Ibu Fitri Arofiati, PhD from Master of Nursing, Universitas Muhammadiyah Yogyakarta. And the respected all the committees, participants, and invited guests. All praise is due to Allah, the Lord of the world, the Master and the Creator of everything in the universe, the Destroyer of all oppressor, and the hope of the oppressed, for enabling us to meet together in this international seminar. Peace and solution be upon to the noble Prophet of Islam, Muhammad Sallallahu Alaihi Wasallam, his companions, and his faithful followers until the end of time. Ladies and gentlemen, welcome to Second International. The Second International Conference on Nursing brings out the issues on how to optimize nursing toward the achievement of SDGs through research, practice, and education. With the mind term 2020, the year of nurses to achieve SDGs, ICoNURS give opportunity for nurses to discuss their strengths in order to optimize the contribution to implementing the SDGs. Ladies and gentlemen, this pandemic era does not inhibit our step to work and innovate. This international conference was followed by lecturers, researchers, practitioners, and students, which held online. This international conference had accepted 120 abstracts that comes from institutions from all over Indonesia. The outcomes of this international conference will be published in international journal indexed Scopus, international proceeding indexed Web of Science, and national accredited journal. Ladies and gentlemen, this international seminar held with good cooperation and co-host contribution as follows. Universitas Aisyah Yogyakarta, Universitas Muhammadiyah Purwokerto, Universitas Muhammadiyah Semarang, Universitas Muhammadiyah Surabaya, Stikes Muhammadiyah Gombong, Stikes Yatsi Banten, Poltekkes Kemenkes Yogyakarta. We are thankful for this given trust on this international conference. We also want to thank and appreciate to all committees, sponsor, and all parties that support this international conference. Welcome and thank you for all participants who have arrived in Universitas Muhammadiyah Yogyakarta. We hope all activities in this international conference run smoothly and successfully. Amin ya robbal alamin. Billahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Dr. Titi Huria, for the opening remarks. I would like to invite the chairman of the Indonesian National Nurses Association, Mr. Prabo, Master of Science, to deliver his opening remarks. To Mr. Prabo, Master of Science, the time is yours.
Thank you. Bismillahirrahmanirrahim. The Honorable Rector of Universitas Muhammadiyah Yogyakarta, the Honorable Director of Postgraduate Program, Universitas Muhammadiyah Yogyakarta, the Honorable Dean, Faculty of Medicine and Health Sciences, Universitas Muhammadiyah Yogyakarta, the Honorable all keynote speakers, both from within the country and abroad, and all participant nurse college whom I respect and are proud of. Assalamualaikum warahmatullahi wabarakatuh. Good morning. First of all praise to Allah Subhanahu wa Ta'ala because of His mercy, blessing and health to all us so that we can meet in the virtual conference of Second International Conference of Nursing, ICoNURS, at Universitas Muhammadiyah Yogyakarta, October 13, 2020, with a great condition. Dear colleagues and conference participants, on behalf of Indonesian National Nurses Association, Representative Council of Yogyakarta, I feel grateful and thankful to Universitas Muhammadiyah Yogyakarta who had been held this conference as a venue in nurses education development, especially in Indonesia and world generally. This year, the theme of this conference is 2020 Optimizing the Contribution of the Nursing Workforce to Achieve SDGs through Education, Research, and Practice. This theme was taken according to the situation nowadays where SDGs is a priority target that have to achieve and become an attention for all parties in the world. This policy should become a big attention for healthcare professionals, especially on nursing professions, who has take a role in the every society change to health. Nurses have big potential in the success of achieving SDGs through their role in the clinical, community, and institute settings. Nurses can take part in their role as educators through public education, nursing services coordinators, as health service reforming agents with various innovations to improve health status. Nurses have a great potential and in a strategic position in achieving these SDGs goals because nurses occupy the largest proportion of all health workers in the world. Besides, the development of science and nursing professions education in the world today also shows a significant development with the existence of educational institutions at the undergraduate, postgraduate, specialist, and doctoral degrees. This shows the existence of nurses as a profession laden with the knowledge and the ability to provide nursing care to improve the degree of public health and further to support the achievement of SDGs. Ladies and gentlemen, these conditions must be put to good use as an opportunity for nurses to be able to demonstrate their ability to contribute to achieving the SDGs goals. It is hoped that all nurses around the world will contribute and become the foremost leaders in developing sustainable health under the goals of the SDGs through this conference. This theme will inspire how to opportunities of nursing profession in its participation in the achievement of SDGs achievements are successful. Last but not least, my appreciations goes to the participants, nurse colleges from various countries that already joined and who have taken the time to participate in this activity. At the end, I am pleased to welcome all participants of ICoNURS. I sincerely hope you will enjoy this conference until the end of the event. And I also hope this conference will give a positive contributions for nursing development in the world. Thank you for your participation. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Mr. Tri Prabowo, Master of Science, for the opening remarks. Ladies and gentlemen, now we move to the main agenda plenary session that will be led by our moderator, Mrs. Erna Rohmawati, PhD. Her current position as the Vice Director for Academic Affairs, Postgraduate Program, Universitas Muhammadiyah, Yogyakarta. She also ever be Chief Editor of Indonesian Journal of Nursing Practices, Universitas Muhammadiyah, Yogyakarta. She also be the reviewer for Nursing Education in Practice, Asia Pacific Journal of Oncology and Nursing and Health Sciences, Progress in Palliative Care, International Journal of Nursing Practice. Her expertise in medical surgical nursing, especially in palliative care. To Mrs. Erna Rohmawati, PhD, the time is yours.
Okay, thank you, Miss Aiza. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirabbil alamin wa bihi nasta'inu ala umri dunya waddin wassalatu wassalamu ala asrofil anbiya'i wal mursalin. Good morning, everyone. I hope that you are all okay. Okay. First of all, I would like to congratulate to the committee for conducting such great event. And secondly, it is my pleasure to moderate the plenary session of the second International Conference on Nursing. This year, 2020, is designated by the World Health Organization as the International Year of the Nurse and the Midwife. Nurses have a very important contribution to the health of people and also in the achievement of Sustainable Development Goals, or SDGs. These contributions are not only in the field of clinical practice, but also in the academic and also research. In addition, nurses also have a crucial role on daily basis. For example, in this pandemic era, nurses' courageous in facing of COVID-19 virus should be recognized. Therefore, our conference theme this year is Year of Nurses 2020, optimizing the contribution of the nursing workforce to achieve SDGs through education, research, and practice, dedicated to the contribution of all nurses globally and particularly in Indonesia. Today, we will have three speakers who will deliver their speech virtually. The first one is Professor Aisha Holloway from University of Edinburgh, Scotland. And the second one is Associate Professor Lim Swee Hia from Singapore. And the third one is Dr. Fitri Arofiati Master of Art in Nursing PhD from Universitas Muhammadiyah in Yogyakarta, Indonesia. So for this session, each speaker will have 30 minutes. And at the end, we will have 30 minutes for question and answer session. I would like to remind you that you could ask question by raising hand or also write in the chat room. And Professor Holloway is unable to be with us today due to time constraint because Indonesia is 5 hours ahead to Edinburgh, so it's very early there. But she is more than welcome to answer any question from all of you. So ladies and gentlemen, before we start, I would like to remind you to mute the volume to avoid any disturbances during the presentation later. The first speech will be delivered by Professor Holloway. She will talk about research-led nurse to influence global health policy. Currently, Professor Holloway is Head of Nursing Studies, Professor of Nursing Studies, the University of Edinburgh, Scotland, and she has a very strong interest in nurse political leadership, both nationally and globally. She completed a leadership program at Harvard Business School in 2014, and currently she is the program lead of Research and Evidence for Effective Practice. The Global Nursing Now campaign partners with International Council of Nurses and WHO. In 2017, Professor Holloway was invited to submit written and oral evidence to the Scottish Health and Sport Committee, Scottish Parliament. And she has several project grants and published for more than 50 papers, and she has been awarded with many prestigious awards. For example, in 2019, Kefal Star Award. Let's start the conference with the first speech from Professor Holloway.
Hi, good morning, good afternoon, and maybe good evening to the delegation of the International Conference on Nursing Research. I would like to thank you very much for giving me this opportunity to speak with you today, very far away on the other side of the world in Indonesia. My name is Aisha Holloway. I'm Professor of Nursing Studies and Head of Nursing Studies at the University of Edinburgh. And I have many friends in Indonesia that I've met over the years, nurses who have come and studied with us in Edinburgh and are still with us in Edinburgh doing their Masters or their PhD. So I'm delighted to be able to have this opportunity to speak with you today. I wanted to let you know a little bit about who I am before we start. So like many of you who I would imagine had a dream to one day become a nurse, I wanted to share some photos about the inspiration behind that. So you'll see some images of me here as a little girl, and it became very clear that I wanted to be a nurse. It was all I ever wanted to do, with some key milestones: my first day at school, my 4th birthday, my little red shoes, and with my mum, who was a huge inspiration and still is. And I'm sure you've had many others in your life who inspire you. So there I was, anything you want to be. And for me, obviously, it was be a nurse. And I'm glad that I have the opportunity today to speak with you and discuss nursing now, where we are with our workforce, the challenges that we have. And I want to tell you a little bit about my interest in global health as a nurse. Here at the University of Edinburgh, we've just set up a partnership with our Global Health Academy. And that has been a long burning ambition of mine, because I definitely understand the need for us to connect globally, not just operate in our own silos within our countries, but to share experiences to help each other as a profession for the greater good of the general population across the world. And of course, we have the Sustainable Development Goals published by the WHO, and that really give us a framework for understanding where we can contribute. If you have time at all, please connect with these links. We would love you to be part of our Global Nurse Initiative at Edinburgh. But let's move on. So nursing studies is a vibrant department. We definitely want to achieve many things. We want to engage with nurses and midwives as caring pioneers, scientists, and impact. Our Global Nursing Initiative looks at working in partnership, contributing to Sustainable Development Goals. And hopefully, as a larger global response as nurses, we can do that together. Today, I want to talk to you about the impact of the nursing workforce globally, what that looks like, how it can help us achieve universal health coverage, the WHO's commitment to nursing, and we've seen that with the State of the World's Nursing Report published earlier this year, and then think and consider about different ways that as nurses, in our practice, we can meet those Sustainable Development Goals. This is a time for global change. This is a time where nurses in the workforce are needed more than ever, and we've demonstrated that with COVID-19, for example, international disasters. And the role that we have to play must not be underestimated by stakeholders, governments, policymakers. It is our role to be able to influence policy, take the evidence that we create through research, through our leadership, through our practice. This is a once in a lifetime opportunity for us, a once in a generation opportunity for nurses. And by you having your conference today demonstrates that in Indonesia, in Southeast Asia, my colleagues, you, are doing exactly the same thing. We are coming together as a force for change. So let me take you back a little bit and put some context around how we understand what the evidence suggests and the narrative that we can use when we're engaging with policymakers and those of influence within regulation, government, stakeholders. There was a report published a few years ago by Lord Crisp, who chairs the All-Party Parliamentary Group on Global Health in the House of Lords, Westminster. And this report really was a catalyst for a number of things that then happened as a result of it. I would ask you to go and look out this report and read about it, because for the first time we were able to articulate exactly what it was that nurses were able to offer in a way of improving health, not just improving health and better health, but stronger economies, greater gender equality. These are key things that are above and beyond what the general population and policymakers and government think that we can change and impact on. And the report was called the Triple Impact Report, interestingly. And we talk about that. It's a great line to use when you're talking about nursing to those people in influence. What is the triple impact of nursing? And suddenly you catch their attention. Stronger economies, the economics and the geopolitical landscape require us to engage with that economic conversation. What are the benefits of investment? When we are requesting governments to invest in nursing, we need to help them understand what benefit that will bring, and it brings many. I was lucky enough to contribute to the Triple Impact Report, and I was very interested, and still am, in how we are seen as a profession to be visible, to be credible, and to be influential in directly shaping and developing the evidence base within the political arena and across governments and organisations. And I did that with a colleague, Professor Pam Smith. At the time, I had a Florence Nightingale Foundation Leadership Scholarship, and I went out and I met with nurse leaders I interviewed them, I asked them questions, I asked them how they were able to have a position of influence. How were they able to start a dialogue? How were they able to affect change? And I came up with this list of, I guess, requests or needs or wants. And some of that was around giving us opportunities and skills to develop our political leadership skills. There needs to be positions for nurses within government, at the table, being able to articulate and tell governments what it is we offer them in terms of the challenges that we face. We need nurses to be at the highest level, and particularly their ability to undertake research, rigorous research, develop the evidence base within the local context, within the national context, and work together globally and internationally. It's very important for nurses to understand the role they have to play. And we want to develop capacity and capability amongst our profession. So hopefully within Southeast Asia, I know, because I know many of you have come to Edinburgh to study for your Masters and your PhDs, that you really want to take on this role and want to position yourself and come together so that we can. Here is a man, Dr. Tedros, the WHO Director General, who is a great role model for us and one that we must be very grateful for. He has provided a platform for us nurses globally. And under his leadership of the WHO, we have many wonderful, the Year of the Nurse and the Midwife. Absolutely fantastic. But let's get back to the business in hand. All roads lead to universal health coverage. All people should have access to preventive, curative, promotive care, certainty and sufficiency. And Dr. Tedros uses that phrase, all roads lead to universal health coverage. It's a top priority at the World Health Organization, and it's one that nurses can engage with through the many spheres of our practice. So, how do we achieve universal health coverage? Well, considering the Sustainable Development Goals is one key area. And you'll see, if you look at the 17 Sustainable Development Goals, it's not just the one goal about good health and well-being. I could argue, and you could, that nurses have something to contribute to every single Sustainable Development Goal. No poverty, zero hunger, quality education, gender equality, reducing inequalities. Together, many of these really relate to planetary health. And I know there's a great colleague in the States who's the Yale University, Anne Cluth, who her work really focuses on planetary health and nursing's role within planetary health. Another area I would explore and understand. This is not just about health. Our populations do not just operate within an isolated sphere in their day-to-day lives. They are impacted by many things. Their health is impacted by many things. Their health is impacted by their working conditions, employment, clean water, peace, justice. Many of these things are relevant to health, and our role as nurses in that has to be made clear. Two other things I would like to draw your attention to when we're thinking about the impact of nursing, and two documents in particular. The one is the Global Strategy on Human Resources for Health, and that really is around accelerating progress to universal health coverage and the Sustainable Development Goals. It's about the nursing workforce, the nursing and healthcare workforce contributing to the Sustainable Development Goals. So please go and read this report, engage with it, understand where your country may position itself and what your role may be. And the other report that has come out this year, a crucible for nursing, is the first ever State of the World's Nursing Report. And it focuses on education, on leadership, on advanced practice. It focuses on many things. For the first time ever, we have up-to-date data across the member states around many things linked to nursing, not just the number of nurses, but retention, recruitment, the age of the workforce, the research evidence base, many elements of this report. And what we're now trying to do is look at transforming this report into some type of strategy and action. It can be taken within every country. So the data is very important, and we'll come back to that a little bit later. The data in the State of the World's Nursing Report, this is not a one-off for us. We need to be working with stakeholders, with our regulators, with our governments, with our together. It's not just about nursing in the front line, it's about universities recruiting students in to be able to educate. And influence safe staffing levels, influence investment in our profession. So these are all things in the State of the Nursing's World Report that you will be able to engage with. So again, spread the word and keep involved in this dialogue at the World Health Organization. The expanded role of the nurse, I would say, is one of the key elements of us being able to address the Sustainable Development Goals. We know that nurses are willing to do this. We know that nurses, back in 2012, there was a survey across 8 countries by DeCola and colleagues. And even then, nurses identified that they wanted to use their knowledge, skills, and time to educate individuals on the threat and prevention, very much from a treatment-focused way of delivering and responding to health needs to prevention. Treatment only is not sustainable in our growing population globally, but prevention is absolutely a key area for nurses to be involved in. We are the largest group of health professionals. We are people that the public trust. We have legitimacy of engaging with the population. Therefore, this is our time to be able to step up and be enabled to practice within the whole sphere of practice. Likewise, nurses are underestimated often in their ability to adapt, to change the situations. We make decisions every day that are highly complex, are never in a consistent environment. It's fast changing. We're dealing with many different types of people. And that is really what is required for us to do this. And to do it well. Here is Annette Kennedy. She's the president of the International Council of Nurses, and I've had the privilege of being able to work with her in her role on the board of the Nursing Now campaign, which I'm sure many of you will have heard of. And Annette writes about a wonderful case study in Tonga, where nurses have played a key and central role in controlling and stopping the development of particular NCDs. And that has taken place through partnership working, through nurses being enabled to position themselves in a way that they can practice to the full scope of practice. And she writes about it well in this paper. And I would say the paper focuses largely on community-based nursing, and around diabetes, for example, is one of the conditions. And in Tonga, they have identified that nurses have this ability started to understand that governments, policymakers, they saw excellence, not just in the prevention and the face-to-face care, but also in the data monitoring. And that's really key for us as we build the evidence on the impact. The State of the World's Nursing Reports identifies that one of the weakest areas for us as a profession to be able to demonstrate our impact is the evidence-based nurse-led interventions. So what they then was reduction in hospital admissions and cost to treat diseases. So there we have the economic leverage. We can impact on those outcomes further down the line, and we can demonstrate that impact through our research and evidence base. Now let's turn to Indonesia. So I've done a little bit of homework, and I'm very excited to hear about the work that's going on there with governments, with legislators, and with you yourself as nurses. So I know that back in 2014, after a long campaigning for a legislative act to look at the contribution that nurses can make, the House of Representatives passed a new Nursing Act. And this is the first step for us, seeing that nurses are able to take what it is they want and would like, engage with policymakers, governments, regulators, and look at how they can push forward the scope of practice, this quality of care, improve public health. So I'm delighted to hear about Indonesia doing this, because interestingly within the UK, we're our scope of practice. Understanding what that looks like, understanding what the parameters are like is very challenging for us, but actually it's a conversation going on globally in Australia, in the UK, and our colleagues in England are doing some very interesting work around defining that advanced scope of practice. I would love to share with you one of the stories, case studies and programmes that we have with the Burdett Trust and the Edinburgh Global Nursing Initiative, where in Liberia, for example, we have a programme of work working with the government, working with universities, working with regulators, and working with charity organisations. And what we are helping to do there, support this work, is look at ensuring sustainability of midwives and nurses being able to work to the highest levels and scope of their practice. So we have midwives in Liberia undertaking cesarean sections in certain circumstances where there is not an obstetrician available, in rural areas where, you know, there would be no hope for the mother and unborn baby. And we're seeing that work, and we're starting to work with our colleagues there and partners to look at building the evidence base to demonstrate impact, working with universities to ensure that they are able to take over this educational component, so that the future of maternal and child health in Liberia is secure. And we can see this model of working could actually work in many other places across the globe. So only by working together in the farthest parts of the regions will we be able to learn from each other and push forward for that change. So I congratulate Indonesia in their steps in doing so. So the Year of the Nurse and the Midwife. What have we seen from this? A once-in-a-generation opportunity celebration. Dr. Tedros announced the Year of the Nurse back in 2019, and this is the moment that he did that. So this is an opportunity for us as nurses to use the campaign as a platform. The path to universal health coverage, nurse-led clinics, more specialist nurses, development of midwifery services in primary healthcare, health promotion and disease prevention. These are all key things that we need investment in so we can develop the workforce to focus on these areas. And another key area that we must think about is our young early career nurses. And I use this as an example. These are a group of young early career nurses who came with us, the Nursing Now team, to Geneva last year from across the globe. They were given this opportunity, funded by the Wish Foundation. And we took them to the World Health Assembly. We gave them the opportunity to walk the talk with the Director General. And this was all about really enabling them to understand what was possible. It's no longer okay to stay and just work every day without being able to influence at a higher level. And by giving this opportunity to these early career nurses, many of them have gone on to do wonderful things. And you can do that too within Indonesia with the Nightingale Challenge, which is part of the Nursing Now campaign. And you'll see here who else they met, Michael Marmot. So his work on inequalities in health is world recognised, and here he was meeting our early career nurses. It was a wonderful opportunity for them. But how do we create leaders? How do we take these early career nurses and help them understand their role in navigating the landscape? Well, there are many elements to this that we will talk about, but one of them is around networks. Strategic networking is all about relationships. The stakeholders you need to engage with will enable you to make change and have impact. So have a consideration about the role on that. And if you go to the Nursing Now website, you will see there are many tools, webinars, opportunities for you to be involved. And the Nightingale Challenge now has over 30,000 nurses, early career nurses, and it reaches out to employers and helps support them to develop early career nurses. So let's move to this focus of policy making and influencing. On one side, you have what you want to say, and on the other side, what they, policymakers, are interested in. And these can be two different things. And somewhere in the middle is the relevance of that conversation. So you need to know that it's everything you may want to say may not be what you need to say. So you need to understand what their priorities are and how can you be able to help them achieve those and do that together. There's a great quote by Warren Bennis, who was a contemporary in the field of leadership, because many people think that having power and position is what is needed. It is not. What we want is to be able to give early career nurses and nurses across the globe power to be able to have a voice. If we have a voice, we will be able to influence. So, some homework for you, some reading around policy theory. And it may be slightly different in different cultures and countries, but this is a great book if you can get your hands on it, or just thinking about policy, because we've talked a lot about using the evidence to inform policy, but often the implementation and application of that can be difficult because there are many actors and individuals involved in policy making. So it's not that easy, I have to admit. We do have some frameworks around here, and here's one of them, the Advocacy Coalition Framework, developed largely in the US, but can be adapted. And I'm using this just as an example of the complexity of that policy landscape. Who's involved, who the actors are, where policy is made, etc. So this really represents the complexity and the need for us to understand that and be able to navigate it. We can do that through networks, expanding our networks, developing our range of and scope of networks. We need networks outside of nursing. And that's one of the criticisms I would have of our profession. We talk to each other and we become an echo chamber. We need to talk to people outside of nursing. So the advocacy framework that I showed you there tell us that there are many different actors. Some are people who are very much consistent within that policy base, some who come in and out, some who broker coalitions and partnership, and then entrepreneurs who are trying to push a policy position. And I would like to see nurses fit and own this space of being entrepreneurs. And like any good academic, there is some papers and evidence around this. And I've put a few on the screen just so that after today, you've got the opportunity to go and look and read these papers and understand this a little bit more. So policy entrepreneurs, that's what we're going to call nursing now. That's my key message from today. I want you all to be policy entrepreneurs. And why shouldn't we? And Paul Kearney is a wonderful colleague, not too far from Edinburgh in Stirling University, who does some wonderful work around this. So the hero of today is the nurse policy entrepreneur. And it shapes and tells you where there are weaknesses in an area like this for us as nurses, and where we can really strengthen our position, and how to be a successful policy entrepreneur. And also narratives. Policymakers very much enjoy a story. What is the story that you want to tell them about your particular area or priority? What story do we want to tell policymakers about nursing? Well, we want to tell them about the impact, and we want to give them an example of that so that they can connect with it and it speaks to them, not just on a cerebral level, but on a personal level. It talks to their heart, it talks to their authenticity, and it talks to their true north. And the final paper, again by Paul and Catherine Oliver, who write quite a lot about influencing policy. And this is for academics in the audience, but is relevant to practitioners. How do we engage with policy making to achieve impact? And we've got some idea about what the challenges are. As a researcher, we're less comfortable in that environment, so we can be a little bit vulnerable. There is an issue around gender and ethnicity. And then where do we draw the line between tailoring our evidence and playing to the political audience? So there must be some ethical boundaries around here. As researchers, we are independent. We present the evidence. We can't manipulate it so that it meets the policy need. We can provide it and help understand for these policymakers, but we must remember our ethical boundaries. There is also a window of opportunity, and we have to understand it may never come. If you have an idea, it may not be the right time, but do not give up. Keep that idea, and later on it may become an evident and useful idea for you to utilise. Some considerations. Policymakers, they consider the evidence, but they perhaps don't have it all. They also work within a complex policymaking system, which is forever creating new challenges, new priorities. It's fast-paced, it's moving. So we have to understand that and be ready to catch that opportunity. So the rules of engagement take time to learn. It doesn't happen overnight. It takes years and years. And I'm going to give you some examples from my own work. Here we'll see there is a literature review around barriers and facilitators to policy making. And we'll see here that personal contact is a key facilitator. Research is a key facilitator. Timing is a key facilitator. And trust is a key facilitator. And these are all the things that we have to work to build up through our relationships. So future approaches, you need to frame and persuade, you need to form coalitions and build relationships. You need to have the scientific information with simple stories. You need to exploit or adapt to the emotional ideologies. What goes on? What is that particular policymaker or ministerial, what's their priority, what's their area of interest, and can you capture and can you hook into that? So for me, with my alcohol-related harm research, I'm going to just take you through some slides that demonstrate how I've been able to make some impact in that policy landscape. So I had a project, it's here, you can look at these slides later, but we involved parliamentarians. We went to some ministers of Parliament and we said, we knew they had some interest in this area. So we told them about our study, we made it engaging, we had stories, we had images, and we held an event. And we were able to capture that through stories, through images around alcohol and the impact it was having. And Scotland very much has been leading the way globally around alcohol-related harm in terms of its policy making and minimum unit pricing. So it was about timing, it was the right time. What resulted in that was that it was discussed at Parliament, our research was discussed at Parliament, and we have it here. I've highlighted the people at the time who spoke about it, and that was great. It raised the profile. Did it change anything? I'm not sure, but it put alcohol-related harm on the map, and it let them know that we were working in this area. This is myself and colleague Dr. Sarah Rhinus with the First Minister, and we were able to have an opportunity to share our work at Parliament and have that conversation with her. And that's me there speaking and explaining to her. And remember, you have maybe 1 minute to capture the imagination and get your message across. So that's another key piece of advice. And then I was to give evidence in Parliament around my alcohol and prison work, and you'll see it in the bottom. There I was giving evidence a couple of years ago. On the agenda, different people giving evidence as experts or as people who were able to talk to the evidence. And I was able to go there, and through my research, I was able to speak to Parliament and answer the questions they had in a way to help them understand the landscape around the alcohol research I was doing. And here we are again at the time with the Minister of Public Health and Sport, who we invited along to one of our meetings. And again, it's about understanding what's on their priority list. And we were able at that time to utilise our partnerships, one with our chief exec from the hospital, one from the Minister of Public Health and Sport, and we invited many people across Scotland to come to the event. It's about creative partnerships. And we produced a report as a result of that meeting. So you can see there are opportunities for us to engage, but we need the evidence, we need to have networks, and we need to have a profile and visibility. And finally, let's think about how we can put that together as we come to a close. Investing in nursing to achieve Sustainable Development Goals. And I love this. This is Jim Campbell, who is the Director of Health Workforce Department at the WHO. And I can't find anything better than his 3 Ds. He talks about data, the role of data and how essential it is. He talks about dialogue, the role of NNAs and nurse leaders to use the data, to have the conversation, to have the dialogue about the clinical value of nurses and how that could be considered relevant for policy making and the cost effectiveness of that investment. And hopefully that will drive decision making so that new policies will come into play and be able to articulate the return on investment. So another piece of little good advice, the 3 Ds, data, dialogue, decision making. So I have Jim to thank very much for that wonderful piece of advice. So what next? I think this is where we are at the moment. So at this year's WHO ICN Triad 2020 meeting, it didn't happen in reality in Geneva, it was a virtual meeting, and we have Howard Catton here from the ICN talking about the future steps, the global strategic direction for nursing and midwifery. And you'll see on the side that there were three key priority areas, and there has been a strategic direction for nursing and midwifery report developed. Now, it talks about education and training, it talks about health systems, it talks about competency-based curricula, it talks about leadership and working conditions. All of these things are hugely important. As nurses, we really require a high degree of autonomy to practice. We need to be able to undertake advanced assessment and diagnostic skills to allow us to be able to practice to our full potential. We need education, we need leadership, evidence-based practice. We need to make the economic case. We need the regulators on board, the legislators. We need safe staffing. We need health system reform. We need fantastic working conditions. We need to look at salaries, retention, recruitment, postgraduate education funded. You can see there are many things for us to focus our minds on. But this document and this focus for us globally will help us come together. Here we are at the very end. Thank you so much for the opportunity, and I thought this symbolised the big Scotland and Indonesia coming together. I hope I've been able to give you just a feel for what I feel are the key areas for us to focus on. Thank you so much for listening and giving me the opportunity to talk today. I wish you all the very best with your conference, and please reach out to us here at Edinburgh and become a part of our Edinburgh Global Nursing Initiative. Join the Nursing Now campaign, connect yourself globally. This is our moment and we want and will do this together. Thank you.
Okay, thank you very much, Professor Holloway. That is a very interesting speech. She already talked about the stronger role of nurses and triple impact of nursing, and also emphasized the need of nurses to expand and to be involved in leadership, politics, and policies making that are based on evidence. So let's continue to the next speaker, Professor Lim Sui Hia. Professor Lim will talk about the role of nurses in achieving SDGs. Currently, Professor Lim is the Senior Director, Special Projects in Singapore, and she has enjoyed a distinguished career in the nursing, spanning for more than 40 years. She actively shares and contributes her nursing experience and expertise as a member and appointment in many healthcare advisory committees, including in Nanyang Polytechnic, Ngee Ann Polytechnic, Singapore Institute of Technology, and Curtin University, Western of Australia. Has been awarded with several international and national awards, for example, the Meritorious Service Medal, International Nursing Leadership Award in the South Asia region, presented by Government of Western Australia, Department of Health, President's Award of Nurses, SARS Commendation Medal, and Howard Woman of the Year. Professor Lim also has spearheaded various initiatives in transforming the nursing care in SingHealth, that include improvement in the recruitment and retention of nurses in SingHealth. So without further ado, Professor Lim, you have 30 minutes to speak about your topics. And Professor Lim, the time is yours.
Okay, can y'all hear me?
Yeah.
Okay, wait. Okay, I'm going to share my slides now. All right. Okay. Yeah. So thank you very much for giving us an opportunity to share and also learn from each other, you know, at this your second International Conference of Nursing. Okay. Can you open? Cannot hear me. Okay, can see my slide. Okay, go. All right, now for today, I'll be sharing on strengthening our nursing workforce and also healthcare institution to achieve the sustainable development goals. All right, now for today's sharing, the agenda will be on the overview of nursing in SDG, and this will cover good health and well-being, which includes the key areas for nursing excellence, improving patient safety, reducing nurses turnover rate with leadership, and developing a safety culture. And the other one will be on COVID-19, which I think we are all very familiar now, and our future, and that is adapting to the new normal. Now, what is our current healthcare issue? I'm sure we all face the same situation: patient staff safety, quality, aging population, financial management, healthcare manpower, clinical leadership, technology, chronic diseases, and financial management. Okay. Now, why are nurses important in achieving SDG, the action? All right. Now, counseling and education, that is to improve our outcome of health intervention. And what are the examples? For example, nurses are educated and trained to perform endoscopy, for example, like in Queensland. Now, for clinical intervention, model of care that improve access, quality, efficiency of care, also improve episodic outcome of health. And in Netherlands, self-management teams of specialized nurses to take responsibility for care within specific areas. And in many countries now, there are also APNs, advanced practitioners. Now, for long-lasting protective intervention, a model of care that takes into consideration a holistic approach to the needs of individuals, families, and communities. So that will be on example, will be collaborative partnerships such as inclusive health partnership. Now, changing the context to make individual default decision, there's health is considered in all policies. So, for example, will be like sales of sugary beverages in Vietnam has increased significantly. Now, WHO states that the increased consumption has negative health impact. Socio-economic factors, there is inequitable distribution of manpower, of money and resources, and there is universal health coverage. Today's key areas for discussion, I will cover two areas. There will be good health and well-being, and which includes the key areas of nursing excellence, such as patient safety, leadership, and developing culture. The other one will be industry, innovation, and infrastructure. We'll talk about a bit about COVID-19, new normal. Okay. Now, 135 million adverse events occur each year due to unsafe care in hospitals, and contributing to 2.6 million deaths annually. So you can say that 4 out of 10 patients are harmed in the primary and ambulatory settings. And even 1 in 3 million people face the risk of dying while traveling by airplanes. So far, are you okay? Can you hear me? So,
Yeah, okay.
Now, why do accidents happen? Have you heard of the Swiss cheese model? These Swiss cheese models have a lot of holes, isn't it? And these holes are quite dangerous. If we do not block the hole on time, our patient will be harmed. So the holes could be due to poor protocols, faulty equipment, missing information, inadequate supervision, etc. There are many others. So for example, in medication error, when the doctor's prescription is not clear, our pharmacy may dispense the drugs incorrectly, and this will go to the patients or the nurses in the clinical area. And in the clinical area, or the patients, if they did not realize that the medication is wrong, they may consume the drug medications. And what happened? Our patient is harmed. So it's very important. So if the nurses or our pharmacy or patient discover this is wrong, they block it. So our patients will not be harmed. So it's very important that in healthcare, what is our target? Zero harm. So you can see on this picture here, the first one we've got a medication drawer. Now this is supposed to be a resuscitation trolley. I travel quite a lot, so I took quite a lot of pictures. So this is one of the picture I saw in one of the country in the ICU. Now, MRI is very common, isn't it? We send our patients for MRI. And when they have to start the machine, all the professional doctors, nurses, all leave the room and, then the patient is alone. But sometimes we forget to remove, for example, so when they switch on the MRI, what happened? The trolley, the magnetic impact will suck the trolley, this wheelchair to the MRI machine. And if our patient lie here on this MRI, what happened? They'll be hurt. So it's very important on safe practices. So zero harm is very critical. Okay, the other one is about 8 recommendations for achieving total system safety. So for personal management, it's about leaders establish and sustain a safety culture. Now, the other one is on patients management. So there are a few areas which I'll go through a bit more in the other slides. Okay. Okay. So how do we aim for nursing excellence for better patient care? So the key area of nursing excellence can be divided into two areas: patient safety, leadership, and developing a safety culture. So for patient safety, we can talk about quality improvement care that includes research and development in patient safety, use of safe and optimized technology to improve patient safety, ensure accountability, centralized and coordinated approach to patient safety, common safety metrics with meaningful outcomes, fostering teamwork, patient's autonomy, multidisciplinary teamwork is very important. Okay. So for leadership and develop a safety culture, we talk about leadership. And what is it? Servant leadership, transformation leadership, and developing a safety culture that will include reporting culture, just culture, learning culture. So we need to innovate, educate, and improve. So like now, during this COVID period, we receive a lot of patients' safety bulletins, and now we have to wear masks. So during meals, what happened with our mask on? We have to remove our mask here. And sometimes, we put our mask wrongly. The one facing outside should be up, but sometimes we put the wrong way, so it's also no good for us. And the other one is, do we have emails from our management to update us, on routine updates and daily memos to share about COVID-19, how to take care of ourselves, how to take care of patients, and how to take care of the environment? Do we have courses on patient safety, such as PAPR, and all those mask fitting and all the hygiene practice? The other one is about webinar reporting, incident reporting. Do we share? And also resources on patient safety. These are all very important. Okay. Now, most of the hospitals now, they are moving into technology. I'm sure in Jakarta you have that also, isn't it? So you can see like the housekeeping robot, we call the ILA, and this is help us to clean the hospital. Okay. The other was big clean device. And what is this device? It's the automated escalator handrail cleaner. Okay. Now, during this period in the hospitals, besides taking care of our patients, make sure that they are safe, we also have to ensure that our staff are also safe. All right, we have to take care of each other. So you can see we have this contact-free temperature self-check kiosk, deployed in hospitals and island-wide. And this Spot the Dog Alert robot. And how we use this robot? This one is to help to deliver critical medical supplies, and also detect if safe distancing is observed, in the parks, etc. For this medical device, this is a robot, a surgical robot, which I think you have seen in most countries now. Now, during surgery, our nurses, our doctors will assist our surgeon. But when they use a robot, our nurses and our surgeons now have to assist the robot. Why? The main surgeon is here at the console manipulating the robot. So there's a change. So we have to be trained how to assist the robot. And over here, this is what I call the swab bot. This swab bot is like now we are taking, I think many countries are also using all this, where we take the nasal swab for COVID. So this is also done. Now we are able to get the robot, all this, to do it for us. And this is called the TEMI. Okay, TEMI is a remote control robot that allows our doctors, our nurses, to communicate with the patient remotely. Okay, and now we're also moving into encouraging a lot of teleconsultation. Okay, so in the hospital, it's very important that we communicate clearly. You look at this picture here. What happened? You see our patient dropped onto the floor because the leader said, we must count 3. By 3, then we leave the patient. But then they did not communicate properly. The patient dropped on the floor because they did not finish counting up to 3. The patient is already on the floor. So we need to communicate our goals clearly in order to achieve the desired outcome. Now, this is about, I'm sure you are familiar with patient safety goals. These are the 6 international patient safety goals. I will not go into much detail because of the time constraint, but I think you're all very familiar with it. So for goal 1 is about identification of the patient. Make sure that every patient, they must have 2 identifiers before we do, give them medication or draw blood. Make sure that they are correct, patient is correct. The other S bar is about communication. All right. Goal 3 is a medication, high risk medication. Do we have look into all these high risk medications? Look alike, sound alike medicine. These are areas to look into. Goal 4 is about we have to time in, time out, stop, check, and clarify. Okay. Goal 5 is about infection control. Okay. And goal 6 is about patients fall, and we are very concerned on patient fall is injury. We do not want patients to have to be injured or cause any harm to our patient. So performance control and monitoring, we have cross audit, we have to ensure that we have high level of standards of infection control in the hospital. So right now, we are looking into is to make sure that there's safe distancing for our patients, for our staff. All right. And like in offices, sitting 1 meter apart, which may be a bit hard, not easy, but we try to separate them with some monitors or printers so that they don't come close to each other. All right. And we also have all these notices and also have these posters about safe distancing at workplace. Okay. Now, the other one is, I'm sure in most of your hospital in Jakarta will also have all these. Now, this is about all these signages that we place outside the infection isolation room so that the healthcare provider, anyone that goes into this isolation, will know what type of precaution to take. For example, you look at this one, droplet precaution, so that they know when to use a surgical mask, when to use an N95 mask. So for the droplet precaution, you just need to wear a surgical mask, put on the PPE, the gown, and the glove. So for this airborne, you have to wear N95 mask. So with all these signages, we put it outside the room so that everyone or anyone that walks into the room, they know that what precaution to take. And we do not allow our staff to come out of the isolation room with their PPE. It's wrong, okay? For these nurse-sensitive indicators, which I think we're all very familiar with, what we monitor will be the falls, patients' falls, pressure injury, or prevalence. So here in some countries, we call the bug day. Bug day meaning that we're going to check patients for pressure injury. And for this ventilator-associated this infection is in the ICU. CORTI is about urinary tract infection, isn't it? CLEPSI is about the lung infection. So all these are nurses very important. These are nurses sensitive indicators. Now what you see here is NDNQI. NDNQI is we compare our this dashboard or our indicators performance internationally compared with other countries and hospitals where we are. Are we above? Are we below the national benchmark? Empowering the patients and caregivers are very important. So we now with the patients, sometimes they bring the patient home. So we have to train and support our caregivers so that they can continue the care of the patients at home and they don't have to bring back to the hospitals so often. Now, the other one is also our patients, and family members. We also have to educate them. For example, when they go home, what they can eat, what they don't eat so much. So, for example, I'm sure all of us like to eat durian. I like durian too. So, do we know that if we consume 4 medium-sized durian, it's equivalent to 1 bowl of rice? So these are the information we have to share with our patients, our family member. For example, fried fish, steamed versus a steamed fish, fried prawns versus a steamed prawns. So the calorie is very different. All right, so these are the information we have to check and help and guide our patients and their family members. Okay, so patients, we must always remember patient is at the center of what we do. All right, and we put our patients in the center and we move around there. Doctors, physiotherapy, social worker, nurses. We move around the patient. All right, with us. All right, so this is very important for health outcome, also enhance the patient satisfaction and also job satisfaction for the